Let us discuss some aspects about the Sinovac vaccine, or also called the CoronaVac vaccine. The characteristics of some of the approved vaccines is given in this slide, and Sinovac is at the end. It is an inactivated vaccine. 2 doses are needed. It can be stored at normal fridge temperature. The efficacy is between 51 and 84, which we'll discuss in the next slides. And the stated cost is $30 per dose. And the other vaccines that have been approved are in the slide. So the CoronaVac or Sinovac vaccine is made by the Sinovac biotech company in China. It's an inactivated vaccine. That is, the virus is killed and used in this vaccine. The CZ02 strain of SARS-CoV-2 was used for this vaccine, and this was isolated from the bronchoalveolar lavage of a patient in Wuhan. It's cultured in viral cells, then it is harvested, inactivated using beta-propiolactone and purified, and aluminum hydroxide is used as an adjuvant. There are no preservatives in this vaccine. So the 3 microgram preparation is used in 0.5 ml and a 2-dose regime at an interval of 2 to 4 weeks. And I'll tell you why the 2 to 4 weeks was given by the WHO when they approved it recently. It's stable at 4 degrees centigrade, and the stated cost, as I said, is $30 per dose. Preclinical studies showed no developmental toxicity or teratogenicity, and studies in rhesus macaques showed the 3 or 6 microgram dose to be immunogenic and protective against SARS-CoV-2 infection. Next, we go on to the clinical trials that were done. So there was the Corona-01, which was done in 18 to 59-year-old individuals. It was published in the Lancet. The 3 microgram or 6 microgram doses were used, and the intervals were either 0 to 14, and the phase 1, the numbers were shown, phase 1 and phase 2 trial numbers are shown in the slide. So considering safety, immunogenicity, and the production capacity, 3 microgram dose was selected as going ahead in the phase 3 trials. We must remember that the immune response was low in the phase 1 trial, but was increased in the phase 2 trial, and the reason was that they had changed the production process, where there was a higher proportion of intact spike protein on the purified virions in the phase 2 trial as opposed to phase 1. So that is important. In the phase 1, the response was fairly low. The Corona-02 study was done in healthy individuals greater than or equal to 60 years. Again, there was a phase 1 and phase 2 trial. The interval was 0 and 28 days, and it was well tolerated and immunogenic, and neutralizing antibody response was not reduced as compared to those younger. So these were the 2 important phase 1 and phase 2 trials published in the Lancet. The phase 3 trials were randomized double-blind placebo-controlled studies done in 25,000 participants in 4 countries, Brazil, Turkey, Indonesia, and Chile. In these trials, the 0 and 14-day schedule was used as 2 doses, not the 28 days, not the 4 and 14. Brazil and Turkey had healthcare workers providing treatment for COVID-19 patients included. So they were at high risk of getting COVID-19, and that was an important point to remember. The efficacy was taken as efficacy at 14 days following the second vaccination or the placebo. So the Brazilian study included 12,300 healthcare workers greater than 18 years of age. Remember that those over the age of 60 was only 632. There were 253 positive cases of COVID, and the efficacy was worked out at 50.7 for all symptomatic COVID. It was 100% for hospitalization, severe COVID, or fatal cases. So remember, 50.7 or 51%. Further studies were done in other countries such as Turkey, Indonesia, and Chile. The numbers, including the trials, are given in the table. 13,000 in Turkey, The age ranges were given, and it was predominantly between 18 and 59, and the efficacy is given between 65 and 84. So the efficacy range was in these trials, phase 3 trials, between 51 and 84%. There's a child trial that is going on at the moment, a phase 1, phase 2 trial, looking at the safety and immunogenicity of adolescents and children between 3 and 17 years. 552 participants are to be included, and the estimated completion date is September 2021 this year. So what about the safety of this vaccine? It's generally well tolerated. Local adverse reactions were similar to what is seen with other vaccines, injection site pain, etc. And the adverse effects appear to be less in the older population, especially the Brazilian and the Chilean study. So we know about the efficacy. We know that the trials have been done, and I quoted the stated efficacy. What about the effectiveness of this in the real world setting? So in Brazil, 2 studies have been done, and in Chile, 1. And we have to remember that it was the P1 variant that was in Brazil at the time these studies were done for effectiveness. For symptomatic COVID, the first study from Manners showed around 50% effectiveness. And another study from Sao Paulo, which looked at the reduction in COVID in healthcare workers compared to the previous 6 months. By the 3rd week, vaccination produced a 51% reduction, and by the 6th week, it was 74%. So there was effectiveness from that study. In Chile, where the Gamma variant and the Alpha variant were circulating, there was an effectiveness of about 67% against symptomatic COVID, and it was effectiveness against death in 80%. 1 dose was less effective. It's very important to remember that point, that 1 dose alone is not sufficient. You do need to get 2 doses, and greater than 60 years, the effectiveness was similar. So what about viral variants? We know that there are different viral variants around the world, the alpha, beta, gamma, delta, etc. Predominant in Brazil and in South America, it was the P1 or the gamma variant that was circulating. So the studies, there were 2 studies that were reported. There was a failure to neutralize the P1 isolate, the gamma variant, and there was a lower geometric mean titer against the wild type variant compared to convalescent patient plasma. So that was an important message to note, that there was a failure to neutralize this specific variant. Another study by Palacios studied 45 post-vaccine samples, and they found that there was 69% neutralization of the using post-vaccine samples of the P1 virus, and about 80% neutralization of the P2, or basically the new classification as given by the WHO. So what is the current vaccine rollout of the Sinovac or the CoronaVac vaccine? SAGE WHO recommended its use in people over the age of 18 on the 1st of June. It has been approved in 26 countries. It will come into the COVAX program. And as at April 2021, greater than 260 million doses, that should read million doses, in 160 million persons has been used in the public in China and other countries. So it has been widely used across many countries. So in summary, Sinovac is another one of the 7 approved vaccines by WHO. Sinovac is one of them. It's an inactivated vaccine. 2 doses are needed. Both doses should be given. It can be stored in the fridge. The efficacy rate is between 51 and 84%. I gave you the trials that showed those. And the stated cost is $30 per dose. Thank you very much. Thanks.